I think any mother would look back and say that you never know how it's going to affect you until you're there. And I remember becoming a mother and thinking this is not part of my my self-image. You don't know what it's going to be like till you're there. And once you're a mother, I feel like it really impacts how I care for other mothers, because it's again just a privilege to be there, but knowing that that I get to be part of that the person will always remember the person who delivered their baby, especially if I was able to care for that patient for most of their pregnancy. I think anyone who's a parent realizes when they first see their child, whether it's their first or their last, that that things have changed forever, and there's just so much potential. You have no idea what this little person's going to be like, and all you know is that you want to be there and be part of it. I want the birth experience to be whatever it is that will make it a good birth experience for them. And that's different things for different people. Some people want me to support them in their choice not to have anything for pain, and other people want to know that pain medication will be readily available to them as soon as they want it. And I feel like both ends of those spectrums are perfectly reasonable. Patients are very savvy, and they've done their research on the internet, and but more often they've talked to friends and family and coworkers, and I think that's how most people choose their OB/GYN. We can deliver, cutting-edge, state-of-the-art care in a smaller setting. In a university setting, you're going to have lots of residents and medical students, and you don't have your own physician doing most of the deliveries, and that is something that most people who practice in larger centers with larger groups aren't able to offer. You want to have a place where your family's around you. In this new setup, people can choose to have as many people as they want with them in labor. They can have their mother, their husband, they can have their children if they want. I think they really appreciate it when the staff, whether they're nurses or physicians or techs, go a little extra mile for them. And especially when it's someone scared or hurt or frightened, they really appreciate the time that both the nurse and the physician spend with them to allay their fears and tell them it's all going to be okay. And I think we have a very strong, well-trained group of OB/GYNs with a wide array of experience. I see people over the range of their life, and I knew them when they were teenagers, and now I know them when they're not teenagers anymore. I've helped them through their pregnancies and other, past that point in their life. I think that I just feel very fortunate that these women invite me to be part of their life. I kind of joke that Ed Miller, one of my colleagues, said that he came to Janesville saying he was just going to stay a few years, and that had been 18 years later. Now I'm saying the same thing 15 years later. There's something about this place that people just want to stay. It's a good place to raise a family. It's a wonderful place to practice medicine.